Hey friends, Dr. Motley here with the third and final part of this three-part series with Dr. Chloe Weber, my good friend and doctor of Chinese medicine here on the Ancient Health Podcast. And we have been talking about Chinese medicine with its connection, its interconnection to the body and how it relates to women's hormones. So the first time we talked about certain organs that are definitely correlated to the cycle. And in the second time, we talked about the BBT or basal body temperature. We talked about the aspects of the cycle and how it relates to Chinese medicine. And in this episode, I would love to talk about some of the patterns in her experience about the basic patterns she sees in women's health. And also I would like to talk about how women can take power and control back into their own hands when it comes to the cycle. But first of all, Dr. Chloe, I'm so thankful that you're with us. And everybody out there, please follow everything she does because it's really smart.
Well, thank you so much. It's always an honor to be here. And you know how much I love talking to you. It's just such a joy.
Oh, we're becoming like BFFs. So this is going to be a good one, guys. This is like Chinese medicine BFFs. Like, I had at one time, Doc, I had one of my friends, he was just like kind of not in the healthcare world. And I don't know if he would call him, he would always say, you're like one of those Chinese med heads. Like you're like kind of medical, but kind of Chinese. And I'd be like, yeah, I have old blood that is Chinese. Maybe that's Chinese med head. I don't know. But anyway, but all that to say, for all of you out there, I think one of the main draw for this podcast, where somebody who's reading the show notes or reading the caption would be like, okay, so I do have cycle issues. And I can't get much answers, or I have gotten answers in some ways, but it really doesn't tell me like what some of the core issues are. So Doc, one of the things that you've seen, what are some of the hormonal things you've seen in your office, or some of the patterns? Let's say some of the patterns you see with your patients and how they correlate to Western medicine. For instance, like if you can go any way you want to with this, but what are the most common, patterns within a woman's cycle or their hormone health that you have seen, and maybe how it correlates to a Western medicine diagnosis, but there may be something deeper that you have seen that you need to correct to help that situation. Is there types of clinical visits that you've seen in the last few months or few years that stick out to your mind?
Well, I think a way that might be helpful to break this down, and we'll see how it goes, but one of the things that we look at in terms of the cycle in Chinese medicine and in Western medicine, but we approach it at different angles, is sort of the 4 phases of the cycle. So as I mentioned in the last episode, the first phase is really the menses. You're looking for that to be about 3 to 7 days long. You want to make sure that there are no cramps. You're really not supposed to have cramps. I know that everybody has them, but you're not supposed to. So that is an indication of some sort of hormonal imbalance, likely an emotional imbalance as well. Shockingly, we may be under stress in this society. In that phase, what's happening is sort of the yang energy is going down, the yin energy is going up. And so that's sort of phase 1. There's a lot we can learn about a woman's cycle from how their period's flowing, and that's something we discussed pretty much at length in the last one, so I'll leave that for now. The second phase is post-menstruation, and that's the follicular phase, right? So the yin is increasing, and it's reflecting the development of the follicle, and it's under the influence of FSH. So what happens is if yin is not increasing at the appropriate time, then we're often going to see delayed ovulation. Whereas if yang is not decreasing at that time in the way that it's supposed to, you're often going to see early ovulation. Wow. So in Chinese medicine, in phase 2, what you really want to do is nourish the kidneys and the blood, because we just bled for a couple days, we're depleted, so we really want to nourish ourselves. So just in terms of women looking at their cycles right now, that week after your period, you really want to take extra care with yourself, eat a little extra, maybe some extra really good fats and berries and meats. The third phase is really the ovulation phase, and that is when the kidney yin and the kidney fire, so you can think of kidney yin as estrogen and the ova, And the kidney fire is really the progesterone. They come together in order to create ovulation. So this is an important stage in which we're tonifying the kidneys, and we might also want to resolve some dampness or phlegm. So a lot of times if you have something like PCOS, that's an indication that you have dampness and phlegm that's causing these cysts within your system. So when it's PCOS or fibroids, even some forms of amenorrhea where you're not getting the period, you're going to look at that as dampness and phlegm. Again, we talked about that before. So that's really, you want to tonify the spleen. You want to make sure that your digestion is really optimized. And then the fourth phase is sort of the PMS phase. That's the luteal phase. And so in this phase, the chi and blood are moving in preparation for the period. So that's when you're typically going to see those classical PMS symptoms. So if you're getting irritability, frustration, sadness, crying for no freaking reason whatsoever, that's an indication that you probably have some sort of liver chi stagnation. But it also might be sort of heart fire or liver fire. There are different ways that we can look at that, and they indicate different things. But basically, in that last week of your cycle, you're looking to move the chi and invigorate the blood. And again, you're going to see those PMS symptoms more if you're more stressed. And I think that that's something that most women innately know, if they don't know very, very palpably. But so all of these different things, it's all about the timing of the cycle and the hormonal fluctuations within a woman's month, right? And so we see as as clinicians, all sorts of different things. I mean, I've worked with women with PCOS, endometriosis, infertility. Infertility is one of my very favorite things to treat. As a mom, it is like the greatest honor to me to help other women get pregnant. So I absolutely love that. And really a lot of what we're doing for any of these situations is looking at that flow of how the chi and blood is moving throughout the cycle, how you're connected to your emotions, and seeing how your menses is showing up and how regular it is or irregular it is. Because we can tell a lot about your hormones from the Western and Eastern perspective through that cycle.
Oh, and when you were talking about like your liver fire, when they hear your liver fire and your heart fire, as an example, does that represent like the actual, like the outburst, the heat, the energy, the life-giving energy of that organ, like the fire that's in the liver, like it's actually operating at 100, in 100%, or the heart, it's the warmth that's supposed to be produced by that organ. Is that what the fire would mean, like in those certain aspects of the phases of the cycle?
So in those, that's more of a pathogenic fire. So the kidneys, we want a kidney fire. That's like the menstrual fire. Liver fire is more pathogenic. So in the last one, I talked about how if you think of a liver, the liver is in charge of the free flow of chi and blood. So I think of it as if a tire's running and it's not getting anywhere, it starts building up this heat. That heat creates a fire and rises up and causes irritability, frustration. It can cause heart palpitations. Same with the heart. So all the organs need some sort of balance of that fire that you're talking about, but sometimes it can be pathogenic and lead to some sort of hormonal disharmony or just disharmony within your body or emotions.
Well, because so each phase, that's a great thing for everybody out there to hear, is that as you see that clinically, you'll see that you could have pathogenic or you could have emotional stress, like you say, paying attention to which emotions are coming into the surface at those 4 different phases. And that can give you clinically, like in Chinese medicine, an aspect of like which organ that I need to nourish, help the patient nourish, to help them heal and balance, to actually help them throughout the cycle. Because I love the way you just explained like the yin and the yang, about like we talked about in the very first podcast. It's the yin being the more nurturing, the more cooling effect, the yang being the more outward and expressive, the a little bit more energetic, the extrovert versus the introvert, the person who likes to be, left alone most of the time, and, or the person who likes to go out and talk to a room full of people. Who wants to do that? Anyway, so with these 4 phases, like you say, there's those common things that you've seen, like, so like infertility, you're helping individuals. As a side note, this is not a side note, but people out there listening, because we're going to talk about your new line of herbals to help women. But with infertility, have you seen, like, clinically, I know you have, but you've seen people, like women being able to get pregnant just by following your descriptions of their cycle and then following the herbal pathway? Have you seen that a lot?
Absolutely. And so it's, again, Chinese herbs blow me away. Like I never cease to be absolutely astounded by the power and the brilliance of Chinese medicine. It's truly, I say this all the time, there are two great honors in my life. One is being Remy's mom. The second is being a practitioner of Chinese medicine and trying to help spread the word about how incredibly effective, dynamic, and safe it is. I love it. And truly, any woman listening, I really, really encourage you to find an acupuncturist or a practitioner near you, because if you are having any sort of hormonal issues, this is a way that you can really start to take control of your health in a deep foundational way, instead of putting a Band-Aid on these issues that are just going to cause more issues down the line. Because a lot of times when we're putting these Band-Aids on and taking these pharmaceuticals, it leads to more issues down the line. So particularly when you hit perimenopause and menopause, a lot of these things that you're trying to push down the road and sort of ignore and put a Band-Aid on, those flare their head then and become really, really massive challenges at a time that you probably don't want to deal with it. So it's better to start nourishing your cycle as early as possible. And so women, if you're listening and you have daughters, this is a great thing to start teaching your daughters about. But yeah, with fertility, a lot of times, often, depending on the type of fertility and how long somebody's been working on it, you might give them a different formula for each week of their cycle. Mm-hmm. Right? So we're really targeting the hormones that are going on in each of these phases of the cycle. Or another way that I do it, which is sort of like an off-the-shelf way that often works, is you're really nourishing the kidneys and the blood during the first half of the cycle after your menses, and then moving the qi in the blood and supporting the spleen during the second half of the cycle. And so I would say for about 60 to 70% of women, that's actually just going to do the trick right there. I mean, you can't go out there and then just eat ice cream all day and never move your body and worry and work all night, But, if you're doing the other things, if you're taking care of your body and your mind and your soul, and you're taking those two formulas, like a nourish the kidneys formula, nourish the blood, and then a move the qi and blood formula, that's going to really help balance your cycle and optimize your fertility.
That's a good point. I love the way you said that you can start, your daughters or the young women out there as early as possible. Because, Doc, is it that, okay, so you have the two formulas, or you have the formulas that help nourish the kidneys, that help nourish the spleen and even the liver. And like the innate intelligence, they would say, of the body, like if you start to nourish those organs, are you saying, because many people out there, they could be in youth, mid stage of life, menopause, post-menopause, and they're just like, is there hope for me? Because they're like, I'm having all these other experiences with my hormones. So if you start to nourish those organs, it'd be safe to say, like, the innate intelligence of the body will know what to do as those organs are starting to get healthier and communicate with each other, that you'll start to see like the hormonal arena starting to heal up, and you'll start seeing like, less of the symptomatology, because even at different stages of life.
Oh, absolutely. I mean, I've treated menopausal women was like my whole practice for a while. Not the whole practice, but like I saw a lot of them, and it is rough out there. Menopause is not an easy transition for a lot of women, and Western medicine really does not have that much to offer. Hormone replacement therapies have their place, and if you're using the right practitioner and something that's really dynamic that can be shifted to reflect the cycles, like our natural cycles, then that's what I see works best. But if we're nurturing our bodies in the way that we've seen for thousands of years to be effective in terms of supporting our hormonal fluctuations in a natural way, then those symptoms are going to go away. And honestly, like, we've got to think and start speaking of menopause and perimenopause as something that we're excited about, and something that's sort of like a positive shift. In Chinese medicine, we often refer to it as the second spring. It's an opportunity for us to conserve our reproductive energy, because that's sort of burnt out, but that energy really goes to the heart after menopause. And so it's, in Chinese medicine, it's a time for us as women to really be able to express ourselves in a way that often we're not able to when we're younger. It's a time often our children are a little bit older. And so we have that freedom to really step into ourselves in a way that a lot of us don't get to earlier in life. So it's really beautiful, and it's super dynamic. It's really, really effective.
Oh, it's to take care of yourself. And I'm not saying this because I don't know personally. I mean, I just say, but I'm with so much respect to women. I treat so many women here in the office, and what the body of a woman goes through is kind of mind blowing to me. I mean, honestly, when we were talking in the previous one, we were talking about like you're shifting hormones to become a woman, and then you have to create eggs. And I don't say that lightly. And then you go into having postpartum depression or postpartum after you just had a baby and you gave all your nutrients and vitamins and minerals into the baby's life. And then you go into, menopause, premenopause. I know it's many people. I'm so thankful for the advocates out there that talk about how women's health should be taken seriously. And I love it that Chinese medicine, like you're on the forefront of like saying Chinese medicine should be here to help you find out about your cycle, what should be done. Now, all that to say is that I think that women's health in some ways could have been forgotten in the sense that, you look at people that have menopause or ladies that have menopause, and they just sort of think like, oh, I'm just having hot flashes and I just have to handle it for like so long. Or somebody who's, postpartum, oh, I just got to go through it. Everybody's gone through it. My mom went through it. And no, it's a call. It's a cry from the body that says, hey, if you just nourished me a little bit in this arena, if you could just amplify. And I understand people are tired, but seeing this now, like you're making supplements, you're making vitamins and herbal remedies to help with this. We're going to talk about that, but you've already been talking about like what, you're seeing and what you can do. Is there anything like you would say the action steps for a woman at home to say, okay, everything Dr. Chloe's talking to me is right? Is there stuff they can do at home, or is there appointments they need to set up, or what would be some of the basic steps you would say? Consider this. Let's do this. Whatever stage you are in life to help with your hormone health.
It's a great question, and I think the first and most important step, as we've mentioned before, is that women actually take their health seriously. I know we have been conditioned our entire lives to give and to take care of others. I am so guilty of it. Like those first couple of years, anybody listening, if you haven't heard, like my son Remy has a rare genetic disorder. The first couple of years before he got diagnosed and then after his diagnosis, I burnt myself out so badly. And then finally, after taking Remy to doctors in Ecuador and Colorado and New York and all over the place and doing all of the things, finally, I realized that there's nothing more important to my child than having a happy and healthy mom. And that's been the most important lesson that I have learned that I can pass on to other moms. Because often, honestly, like I get people who will write in or call and say, Chloe, you're doing such an amazing job. It's incredible what you've done for your son. And I look at them and they're also moms. And I'm like, but you're doing the same thing. Like you would do the same thing for your child that I'm doing for my child. You are giving 1,000% the same that I'm giving 1,000%. I do not believe that there are many moms out there who do not feel isolated, unseen, and unappreciated. It's really an absolute epidemic. And so for moms, for women to really deeply start loving themselves and start looking at the ways that they can really nurture and nourish themselves is a radical act in our society right now. So I think that really is the heart of it. When it comes to starting to balance your hormones, there are, as we talked about, I'm launching Noxy, Noxi. It's named after Nox is the goddess of night. So I felt like that was appropriate. It's also the name of my dog, who's a boy, but whatever. But so we'll have herb options for you. Radical Roots has flow state, which is great for regulating the cycle. But really, it's just taking time for yourself, whether it's 5 minutes, making time to go and see your friends, making time to do the things that are interesting to you. Because also, like, and again, I said this in the last one, like, even if you're doing it, if you're manipulating yourself into taking care of yourself to be a better example for your children, remember that our daughters are watching us. Our daughters and our sons are watching us sacrifice our health for them. So, like, you do not want to be that example for your child. Your child and you deserve to be independent people and to be happy and to be healthy. And sometimes that means, like, ditching your kids for a little bit and going out to dinner or going away for a weekend or taking some time to yourself. Like, I promise you, it will make you a better parent, and it'll make you a happier, healthier person, and it will actually positively impact your hormones as well.
That's I can't express, like, you know, the gratitude I have, like, when you're talking about that, because, you know, both of us have an experience in the office where you see mothers who don't take care of themselves, or, you know, the women out there who are caretakers, and the joy's out of their face, and they can't see joy because their joy is lost. And it hurts your heart as a practitioner to see the individuals, like, you know, you're right. If it's a happy mom, no matter what state, I mean, yes, you hurt for your child. I know that. It's like, but you're going to be like, well, you have a little bit better positive perspective if you feel healthier. And that's one thing I love about your formulations, is that I want everybody else out there to hear, is that, you know, the way that Dr. Chloe's talking about, you know, different movements of chi and different movements within the different phase of cycle are all coordinated within the herbal remedies to, like, fashion to help accentuate the strengths that are needed within each phase. So, but I think what you just said is the most important thing, is you just getting the supplement or the herbal and taking it is proof that you're showing love to yourself. Like, you're actually going, I want to take the steps to actually accentuate and give that information, that innate information through frequency, to herbs, to the body, like saying, okay, I want you to heal. Like this, you deserve to heal. And I'm really happy about it. And you deserve to mend. And I want you to mend, and I want to live a happy life. So I hope that everybody out there, and you listen to us talk on these podcasts, is like, it's really about you, all of the women out there, to take hold and with eternally, and, like, see, like, okay, you can mend, you need to mend, you need to heal. And we support you 100%. And so I want everybody out there to check out your line and to see, like, all the information behind it, because I don't think that I wouldn't, Doc. I mean, like, the average would be like, you mean that there's chi rises when I'm having this? Yes. And I wouldn't know that either, but I'm glad that you're out there to explain it to us, though. It's great.
I'm trying. It's always interesting finding the balance of how to explain Chinese medicine when you're like, this is a 4,000-year-old medicine that I spent 5 years studying, and it's both incredibly simple and really complex, but, like, I just want to get the basics across. But no, I love it. As I've said, I'm so excited about the line. I've been working on it for the past year. And so basically what I'm doing with Noxie is we have a formula that really supports the movement of the qi in blood, another one that really supports the kidneys, which, you know, when we go into menopause, what's happening is the depletion of the kidney qi, and particularly the kidney yin. So if we're looking at the yin as the fluid, the female, the cooler aspects of the body, that yin depletes, so the fire flares up. So that's a very easy representation of how we see hot flashes in menopause, right?
Wow, good. Oh.
So we've got Move the Qi in Blood. That's really, like, predominantly a liver formula, if everybody's going back to the first episode. Then we've got one supporting the kidneys. Then we've got one really supporting the spleen, and then one which will also support digestion and sort of overthinking and worrying. And the last one's really nourishing the heart. So we talk about the heart as storing the shen, which is the spirit. And so if you're having some sort of spirit disturbance, if you're having those hot flashes at night, heart palpitations, a hard time sleeping, that one's really great for anxiety. So what we're building out, which has been so complicated, is a quiz module that makes it so that we can really go through your health in depth and figure out which combination of these formulas at what time of your cycles is going to optimize your specific needs in order to help you build your health. And again, what I always talk about with Chinese herbs is that the goal is to help you build health with Chinese herbs instead of responding to disease later in life with pharmaceuticals. So that's really like my passion in what I'm doing. And like truly, it's so exciting and such an honor to step into the women's health lane, because I can't even tell you how freaking pissed off I've been getting looking at some of the statistics on how poorly research has been done on women's health and women's medicine, and it's appalling. So if I can be of any help to help inspire or encourage people to really, again, tap in with themselves and take care of themselves and find that inner wisdom that we all have, it's such an honor and such a joy, because it's truly very personal to me as well.
It's like whenever I'm looking here, because I'm just checking my time over here, because I was like, damn, I want to keep going. All right, but we're out of time, guys. But I would say like that was beautiful, and I mean that. I think that that when we're looking at it and in the aspect of how like it's just nourishment, I am deeply thankful to like in Chinese medicine for the thousands of years they put into like, like when you say, when you have all these herbs that can go nourish these organs. And I just think it's really cool before we leave. I mean, that you can have an herb that could help heal the function of the organ, move blood, move electricity, clean out pathogens, help with hormone regulation, help with your emotional fatigue. And you're creating products that can do all that. That's amazing to me. So anybody out there that's having any questions about any phases of their cycle, please check out Dr. Chloe's new Noxie line. I love the name Noxie, and that's really good. But Doug, these are great. We got to keep doing some of these. And I'm so thankful that, Lindsay connected us. And again, we always have to ask you, come back again. And I want you to let us know where people can find you, and give us your Instagram and your Facebook, any of your feeds, so people can find you.
Well, thank you again. It's an honor. It's such a joy talking to you. And honestly, from all the podcasts I've ever done, your audience is the most engaged and interesting and just really inspiring group that I've yet to connect with. So it's really an honor to get to speak to this audience again. So thank you so much for all of the work that you're doing. It's really tremendous. So yeah, I'm sort of horrible at social media. I'm working on it, but we've got radicalrootsherbs.com is my CBD and Chinese herb line. Radical Remedy is my podcast, and the blog site is radicalremedy.org. And then the new women's line is noxieherbs.com, Noxi. And I'm super excited about that. We're going to be putting up a lot of information so you can learn more and get more in-depth details on each of these different disorders that you're getting diagnosed with through the Western lens, and how we're looking at it through the lens of Chinese medicine, other foods, and acupressure points and different things that you can start doing at home. So whether you buy the products or not, I want to make sure that you have the resources to start taking control of your health in that way. And also, just so anybody knows, I give a ton of discounts to people. Like, if cost is prohibitive to care, especially when it comes to Radical Roots, just email me. I actually care about people more than I care about money. It's not exactly the best business plan, but it's just how it works. So, just reach out if you need to reach out. I'm here.
Oh, you're sweet. I'm not kidding. You guys can tell she really cares about people. I mean, oh my goodness. Really, everybody, please check out everything she puts out. And again, today I'm just wish we had more time, but me and Dr. Chloe can go on a tangent and we can talk a lot. So I was trying to double check and see if I had any more time. It's like, I don't. It's just like, but everybody out there, please check her out. And she's a friend of the Ancient Health Podcast, and we're going to have her on again. And Dr. Chloe, thank you so much. For everybody here, if you have any cycle issues, if you know anybody that has cycle issues, please direct them to this series of podcasts. If you like what you hear on this podcast, just shoot us a comment, like, and subscribe. From everybody here, we just want to say thank you. Thank you, Dr. Chloe. And I know Courtney, my co-host, she would say thanks. And but from all of us here, I hope you guys have a great day, and give Dr. Chloe a shout out. All right, take it easy, guys. Bye.